So, what happens to your body when you take cannabis? First, let's talk about our drug effects. So, we've got some subjective effects. So, this is all at a low to moderate dose. So, none of that 100% THC hash. Okay? This is like marijuana or a low dose of hashish. Then you'll experience an initial lightheadedness or some dizziness. Some people describe this as a buzz. Most people will then go on to experience some sort of euphoria or exhilaration. This is where people might get the giggles. We get some increased laughter. Everything's hilarious. Some disinhibition goes on. So, like, you can dare someone to do something, and they will do it. No more inhibition is happening. And then after a bit, then you get this nice, calm, relaxed, dreamlike state. And this is what people often refer to as being stoned. They're kind of just like calm and like they're like, yo, I'm good, right? And so this relaxation is the most common self-reported effect of taking cannabis. A lot of people will experience drowsiness. So not necessarily sedation. It's not going to put you to sleep, but it's going to make you drowsy. So it promotes this sedentary behavior. It helps calm people down. And then we get some sensory reactions. So some people experience like a floating sensation. Some people get some enhanced visual auditory perception. You can get some visual illusions can happen. So they're not hallucinations. They're just illusions. And then there's also this kind of slowing of the passage of time. My favorite TV scene thing of people like taking cannabis is that 70s show when they all like sit in a circle and they like the camera bounces back and forth. I love it. And you can kind of see how cannabis affects different people differently, because not everyone will experience all of these effects. Now, what are the physiological effects? What's going on in your body? And what happens is we get dilation of small blood vessels in the eyes and skin. So this is where we see those characteristic red eyes. So a lot of times if like cops or parents or suspect someone had been smoking some marijuana, then they'll look at their eyes and be like, why are your eyes red shot? And it's because of this dilation of the small blood vessels. This also increases the blood flow to your skin. So a lot of people report the sensation of warmth. So that's something similar. It's a similar sensation to alcohol, but it is happening because of a different reason. Remember, because we had vasodilation in alcohol, and now we've got dilation, but of only the small vessels. Okay, so less intense dilation. We also do get some increased heart rate, but decreased blood pressure. So you may feel like your heart is pounding, and that's because of that increased heart rate. It can cause dizziness or nausea on movement, and that's because of that decreased blood pressure. So you're not getting as much oxygen to the head, to your feet, that kind of thing because of the decreased blood pressure. A lot of people will experience dry mouth and an increase in appetite. So they'll get the munchies, they'll need to drink a bunch of liquid because of their dry mouth. But again, remember that not everyone's going to experience everything all the time. Now, because it's a drug, there are, of course, some adverse effects. Not everything can always be good. So these adverse subjective effects are seen occasionally. Oftentimes, they're in first-time users. Usually when someone is a chronic user of cannabis, then these adverse effects disappear. So some first-time users will actually experience anxiety or panic associated with paranoia. So this is actually the opposite of some of those drug effects and the use of marijuana as an anxiolytic drug. Some people also experience delirium or even hallucinations. Now, these are extremely rare. They have been documented, but they are extremely rare, and most likely then you'll experience those visual illusions and not a full hallucination, okay? Now, some people that will later go on to be diagnosed with schizophrenia, they will experience these deliriums or hallucinations when taking cannabis before they're diagnosed. So there is a thought that THC or just cannabis could kind of precipitate this psychosis and schizophrenia and may kind of like trigger the schizophrenia turning on, but obviously more research is needed to be done there. So if you do experience hallucinations, it's usually more common with the occurrence of pure THC. So that would be with like hash oil that can get to that 90%, 100% THC, or with synthetic cannabinoids. There's a common occurrence of hallucinations and delirium with these illicit synthetic cannabinoids. So these drugs like spice or K2 can be very dangerous. You're more likely to experience all of these adverse effects when taking these synthetic cannabinoids. Now, headaches have also been reported when people increase the dose. But again, it's usually in like first-time users if they're used to one small dose and then they jump a lot. So maybe you're used to like, just a pretty low THC of marijuana and then you jump straight to hash oil, you could experience some headaches. And then, of course, there are cognitive effects of intoxication with cannabinoids, just like there are with most drugs. So intoxication can result in disordered thinking or speech or an inability to remain focused on a topic. This is why, just like alcohol, we say do not take cannabis and drive, okay? Don't take any drugs and drive. The only exceptions would be like caffeine and nicotine. I think those are the only ones that you're legally allowed to drive with. But any other drugs, don't drink and drive. Don't smoke and drive. Don't drug and drive. So, there's no effect on the recall of information. So as long as something's already in your memory, you can recall it fine. So like taking a drug or taking a test on cannabis should be fine. I wouldn't recommend it, but it should technically be fine. Because THC administration may impact explicit memory encoding and recall. So just the short-term memory. But if it's in the long term, then you're good to go. Now, previous exposure may decrease these cognitive effects. So someone that is a chronic user may actually experience some cognitive behavioral tolerance to cannabis use. So again, we see deficits with cannabis use, especially with sustained attention. So people tend not to be able to focus on one thing for a long period of time when intoxicated with cannabis. There's no decrease in the simple reaction time measures, but it does impair the ability to drive. There's a great YouTube series by the Try Guys where they drive impaired. So they do there's one video on driving under the influence of alcohol, one video on driving under the influence of marijuana, and another one on low sleep. And you can see really the impaired, how it different drugs impair their driving abilities, and how both alcohol, cannabis, and even sleep deprivation all impairs their driving performance. So if you want something fun but informative to watch, those would I recommend. In animals, then IV administration of THC results in mixed effects on locomotion. So at a low dose, then we actually see like mixed stimulant depressant effects. But at high doses, then we see a more uniform motor depression, and really just a full lack of voluntary movement at high doses of THC. So that's kind of that like stoned sitting. So administration does result in deficits in various learning and memory tasks as well that we see in animals. So, don't take cannabis and study. But if you take cannabis during a test, you're probably fine. Again, I'm not recommending it. I'm just telling you what the science says. And then finally, what are the therapeutic effects? Now, as many of you know, a lot of the therapeutic effects are associated more with CBD than with THC. So a lot of medical practitioners will recommend CBD oils or edibles that are high in CBD, low in THC to help with different therapeutic effects. So what are these effects? We see decreased ocular pressure. So people with glaucoma a lot of times will take CBD oil or some sort of medical marijuana to help with the pain of glaucoma. It is an antiemetic, so it promotes treatment for chemotherapy-associated nausea. So it prevents, you don't feel nauseous. It's orexigenic. It's anxiolytic. It's an anticonvulsant and antipsychotic, antispastic, analgesic, and it's antioxidant and neuroprotective. So you can see there are quite a few therapeutic effects. So if you experience any of these, you could talk to your doctor about trying medical marijuana, CBD oils, that kind of thing. And it may actually be a great use for you. So we will leave that there for today. And then, like I said, on Monday, we will talk about the endocannabinoid system. So how our cannabis actually works at a molecular level in our body.